my very great pleasure to introduce Micah Goldwater. Micah is a senior lecturer at the University of Sydney in the School of Psychology. He has particular interest in communicating uncertainty and reflecting on how people can extrapolate anecdotal stuff to more generalizable concepts. So without further ado, Micah.
Hi, everyone. Thank you very much for inviting me. Hold on, I'll share. I'll be talking about anecdotal thinking in health and business, which is, a way where people sort of, in a sense, refuse to embrace uncertainty and instead look for individual instances to frame their decision making that might help them, avoid those feelings. And my hope generally is to promote people's ability to embrace uncertainty in their everyday decision making. All right, so there we go. All right, so how do people make decisions when they have? Sorry, I'm just make sure my screen's all right. People make decisions when statistical information and anecdotal information are both available. So lots of our everyday lives, we're making decisions about our health or about our finances or whatever. We might be aware of all kinds of information based on large samples of data. However, we also hear lots of stories from our friends and family and might read online. And how do people sort of integrate these sorts of things is my research question. So there's a large literature from persuasion and communication showing that if you want to, aligning anecdotes and statistics is more persuasive than either one alone. So if you're trying to convince someone of something, or you're trying to convince someone of meaningful policy, these kinds of things, you need sort of both, right? One doesn't necessarily trump the other, they both come together. However, lots of decisions in our lives their statistics and anecdotes are in conflict, right? So, and we're sort of looking at today, and I was actually surprised how many few studies there were looking at when there were statistics and anecdotes in direct conflict and how people make decisions when they hear both kinds of information. And particularly when we're looking at is when the anecdote is even subsumed by the summary statistics. So in a case where the anecdote really doesn't offer any new information, it's totally subsumed by the summary statistics, and yet are people still influenced by it? And there's some evidence that people who are sort of influenced by anecdotes can lead to some very, dangerous decisions. For example, studies sort of showing that people who are more hesitant towards vaccines are often influenced by individual anecdotes of negative experiences with vaccines, right? And they're sort of weighing that more heavily than the data overall. All right, so I just want to say that these are, I'm talking about two lines of research and looking at health decision-making and business decision-making, and these are both, just want to give proper credit to the students who are leading this work, Sarah Jamillo from Arizona State and Sheer Deckel here at the University of Sydney. So just to dive right into the studies. So to do this, we make up a clinical trial, right? So we sort of had a description of a clinical trial, and we said B12 is injected to treat chronic headaches to people, and this is an unknown but potentially plausible treatment. All right, so our working hypotheses were perhaps compared to when the stats alone, when you add an anecdote that's effective, that might raise people's belief that it is effective, or however, compared to the stats alone, saying an anecdote that's in effect, an individual person didn't appear to work for, that might reduce people's beliefs and their intentions to use this medicine. In this case, our anecdote was just one of the people in the trial. And we just want to say that when we say a negative anecdote, or I'm saying when something's ineffective, we're even having a case where it's not even like there's additional side effects or anything like that. It's just that the symptoms the person started with, they still have. All right, so there's no evidence that the medicine is sort of causing worse things, right? So we're sort of in a way weakening the anecdote just to sort of see how much it still might influence. Right? Because if you hear about a horrible side effect or something like that, that wouldn't be that surprising that would be influential. All right, so I'm not going to go through all the details for time, but if anyone's interested, all this stuff is pre-registered and there's preprints on Open Science Framework. All right, so the way this worked, we had a condition where people heard about this clinical trial, another condition where someone heard about just an individual that this worked out for. That's the positive anecdote early, and the clinical trial suggested that overall this was effective. And then we had both those information where we said we had both the stats, and we go, and here's one of the people from the trial. Okay, here's one of the people from the trial, and how did it, and it worked out well for them. The stats and the negative anecdote, however, we said, here's the clinical trial, here's one of the people from the clinical trial, and it didn't work out for them. They still had the same chronic headache symptoms that they started with. All right, so we asked people originally how much they believe B12 injections could be a medical treatment for chronic headaches, and this is something that people think is plausible, but they haven't heard of previously, right? So we can get a mix of those prior beliefs. However, and then we asked them, do you think it's effective? Do you, after they read the information about it, would you try this? Would you give it to your child? And so what we're seeing here, I'm just going to sort of highlight, all you have to sort of worry about for these graphs is that the statistics plus the negative anecdote is lower than all the other three. So statistics alone, positive anecdote alone, statistics plus positive anecdote, all sort of lead people to the same idea, this is generally effective. However, when you have the statistics and you add the negative anecdote, and then that brings down people's judgment. So people start thinking, oh, this is not actually as effective. I wouldn't want to try it, and I especially don't want to give it to my child. All right, so now the second experiment, we replicated that study, but replaced the positive anecdote only with the statistics with a positive and a negative anecdote. And we thought, okay, well, maybe if they have both a positive anecdote and a negative anecdote, the two might counteract. But as you see in this graph, that's not true. The positive anecdote has no effect, right? Adding the positive anecdote that is aligned with the overall statistics has no effect, but the negative anecdote brings people's judgments down, right? And this is just a scale of how effective do you think this is. Just the same pattern in the other questions, but I'll just skip that for time. All right, so now in the next study, we looked at the use of, we added in this use of icon arrays, right? So icon arrays such as this are these, as you can see here, are these visualizations that are used quite a lot in medical decision aids, because they've been shown to be quite effective in helping people understand risk and probability, where they just see sort of 100 people and you show sort of out of 100 the number of people who have one outcome versus the other. And in this case, there's 87 people who, the thing worked for, who improved their symptoms, and the 13 people who didn't, right? And this has been particularly helpful for people with low numeracy skills. And these are used a lot to good effect in medical decision-making to help patients figure out what paths to choose, right? So I just want to say that in here, when we presented it along with the negative anecdote, we even highlighted the person. So we said, okay, here's that one person from the study that we're talking about, to really sort of hammer home that, this is a minority case, right? So in this study, we looked at people either got presented the icon array or they didn't, they had the negative anecdote or they didn't, but everyone heard the basic statistics of the clinical trial, right? And so what you see here is that there are two independent effects. So on the one hand, the icon array does make people think that this medicine is more effective, but the negative anecdote brings down people's judgments of how effective they think this is, right? And so they're really independent from each other. So the negative anecdote brings down the perceived effectiveness just as much with the icon array present as it is absent. And we were highly piloted to see if we could get an interaction, because if the icon array sort of help people understand the statistics to the point where they were no longer affected by the anecdote, you would have seen an interaction between these two conditions, and we did not. So the tentative conclusions so far, these open questions are, so the negative anecdotes that conflict with the summary statistics had a persistent effects on judgments, even when they are subsumed by the summary statistics, and they portray no new negative effects. You know, this was in the face of icon arrays and sort of counteracting positive anecdotes, right? So this we feel is very sort of, this helps explain those patterns where, say, vaccine hesitancy is related to a single story that someone might hear about something bad happening, despite the overwhelming evidence, because people hear a single not positive anecdote about a medicine and it reduces their judgments. It reduces the judgments of efficacy and willingness to try it. All right, so now it's possible that this might be something specific about health risk, right? That we just sort of get this overwhelming negative emotion that when you hear about something not great happening in someone's health, and that kind of overwhelms our otherwise thinking faculties or something like that. However, or it's possible that people actually think these anecdotes, I should reason on the basis of them. All right, so that's one of the things that's going to drive our next set of questions, but we're shifting in a different domain. So we're going to be looking at similar kinds of issues when people's making decisions about in business. So here, this is what this study looks like. So we tell people, imagine you're in a very large, diversified company with several independent departments, and you're evaluating proposals for a new offshore oil well. And you're also evaluating proposals for a new computer microchip, right? It's a big company that makes both, has both oil and computer products, right? And you have to decide how much of the budget should go to the oil well and what percentage to developing the new microchip. So here there are 7 conditions, okay? Now we have a statistics only condition where we're just, where we tell the executive, you know, all right, so there's aggregating a large number of through aggregating a large number of prior oil well projects, we are projecting this kind of income for this project. This is the profitability that we're predicting. And then the microchip, we told them, is less, right? So if you're only looking at these two, if you're only seeing these statistics, you should basically say, okay, I should put more money into the oil well project. Or, however, there's another case where you just hear about a story of another offshore oil well that failed. That's an anecdote of high similarity to the project you're considering. Anecdote with low similarity is a story of a land-based well that failed. So we're saying it's another oil well, but it's on land, and land-based oil wells are very different than offshore oil wells in terms of what makes them succeed or not. And so it's a less sort of similar anecdote. Then we had a situation where we combined the stats and the anecdote, right? Where we gave them both kinds of information, both the projected profits in the high similarity case, in the projected profits in the low similarity case. And then we did a similar thing, but from this other paper suggested that you can get rid of the effective anecdotes if you tell people to sort of think like a scientist and only use the statistics. Don't use the anecdotes. Just this little nudge, a little reminder can get people to sort of to go, oh, right, I should ignore this anecdote. And we were sort of intrigued to try to replicate that effect. So our key DV is the percentage of money that's allocated to the target oil well project, right? And other measures we're taking, and we'll explain why shortly, is how much perceived similarity they see between these anecdotes and the target projects, and how much they think that the anecdote is relevant to making decisions about the target project. And also the general relevance of the anecdote to making decisions about oil well projects in general. Do they think this is a sound basis for induction generally? Okay. So predictions are that the stats only should elicit the highest percentage, stats only should elicit the high percentage allocated to the oil well project, because that's the clearest that we're just saying it has an advantage. And the effects of the anecdotes are seen in reductions in that percentage allocated to the oil well relative to the microchip. And then if the Weinberg is replicated, this enhanced condition will equal the stats only condition. However, if the anecdote, so what we're going to get is an inductive reasoning process, right? So it's not just about you just sort of see something fail and get kind of scared and just the whole thing makes you go, ooh, I don't like this, right? If it's actually more of an inductive reasoning process, then people are going to directly look at the similarities between the cases and then decide it's relevant and generalize that information to the target project in a more principled manner. All right, so this is just a sanity check that just shows that people overall do think the high similarity anecdote is more similar to the target than the low similarity anecdote, and that's not changed across the different conditions. All right, so there's a lot of stuff happening on this graph. What's going on? All right, so here I'm just going to compare the statistics only to the anecdote only, right? And as you see, right, in the statistics only, what we'd expect, the majority of money goes to the project that has the better projected profits based on the aggregated data, all right? And then in the anecdote, and then we look over here, we see that in the low similarity anecdote, it's pretty similar, right? And however, in the high similarity anecdote, they give much less money to the oil well project. They seem to view this similarity as making it very relevant to their reasoning. All right, so then if we look at them in the middle here, in the combine, which combines the statistics and the anecdotes, and the enhance, which then further tells people, ignore anecdotes, think like a scientist. Now, here, we'll first see that the enhanced instructions have no effect. So we did not replicate that finding, that telling people to ignore anecdotes and think like a scientist does not actually get anyone to do that. So then what we're seeing here is that overall, the high similarity is bringing, combined with the statistics, is bringing their allocations down, but the low similarity is not. So this low similarity anecdote, that's still in the same domain, it's still about oil wells, but it's not seen as directly similar and has no effect compared to when combined with the statistics. However, when the anecdote is seen as highly similar, it does lead to this kind of effect. Right, so just to then sort of explain how, so this next bit, so we asked them how relevant they thought these cases were in general. These oil well cases were in general to thinking about it, and overall, the statistics did make people think, oh, these anecdotes are less good cases, or less generally relevant when they see their statistics to base on. So in that sense, that's positive. However, we're getting, maybe this will be, I'm sorry, I haven't answered questions about this, but overall, people viewed, the more they viewed the high similarity anecdote was similar to the target project, the more relevant they thought it specifically was to deciding about that target project. And further, the more relevant they thought it was, the less money they gave to the target project. So that makes sense, right? So when they saw the similarity, they thought it was really relevant, and they affected their judgments. And that was the same across different conditions. Right, so results summary. The high similarity anecdotes have large effects. The enhanced instructions do not temper that effect. So including statistics does reduce the endorsements of anecdotes relevance to oil wells in general, but not this case specifically, right? So you might go, this is generally this generally isn't really, if I have statistics, you recognize that this makes the anecdote less informative, but when you have a highly similar one, it's very compelling and people reason based on that. All right, I can skip this, right? And so despite the aggregated statistics that subsume the anecdote, when anecdotes are highly similar, they become bases for induction. All right, so overall, statistical anecdotes affected judgment. One did not trump the other. Methods with potential to help stats trump statistics did not, not the icon array and the enhanced instructions did not get people to stop using stats to trump anecdotes. Sorry about that. Although anecdotes certainly have more concrete emotional effects, the effects of these anecdotes are not just emotion. They're seen as strong bases for induction. I just say these next steps, I'm going to do this with expert populations. This was with lay people, but we're going to look at doctors making prescription decisions and managers who actually people who make these kinds of decisions in businesses to see if there's an effective expertise in ignoring anecdotes. But I suspect there is not. There's lots of independent evidence suggests that they will also have case-based decisions. And I guess this is the connect. I realize I must be running out of time here, but just the connect more directly with this themes of this conference. One of the things, I think one of the issues here is when people have Lisa Bearer, who has workshops with policymakers and with consumer groups on how to appraise health information, she says, she'll work with people and they'll say, well, outcomes are different for everybody, so I can't just read the stats. I have to read every case and find the one that's most relevant for me. People say these kinds of things, right? And so, so I think there's not just, so I think we have a lot way to go to have lots of people to sort of understand that having this uncertainty is better for decision making than just finding one case that you happen to think is the one I should reason with. Right, and so I guess, yeah, and happy to talk about these open questions with people at the Q&A later, what ideas we can have to reduce the effects of compelling anecdotes, and also, should we harness outlier anecdotes that are not aligned with the overall trend if it's for goods, for example? So here's an example of this tweet where someone pointed out in America that a young person died of coronavirus, right? So this is a very low, it's very low probability for young people to do that. And so this is kind of against the trends. However, should we be harnessing these kinds of things in our messaging? All right, thanks everybody. Thanks everyone for listening, people invited me, and for my collaborators.